All right. So the other pointer that I forgot to mention, and I can elaborate on a little bit, is that using the language of, this is successful where all else has failed, because you get a lot of that, especially where you are with the other decompression people. People will have gone in for decompression and they will have not got results. I built my entire practice on that a number of years ago because of the guy down the street. Added laser, added the technology. People understood it was upgraded, better. They came in and they got results. And that was the big thing. They actually got results where they didn't get results before. And that will happen with every piece of technology. I had a big shockwave guy down the street. I'm not sure if he's got a soft wave now, but I get a lot of people, well, we tried it and it didn't really work. That's why, again, if you're advertising, if you're worried about overlapping, you shouldn't be worried about overlapping. You should be using those different tools to advertise about all the different options you have. Because, well, if this thing doesn't work, I'm not a one-trick pony. I've got other things I can do. If you've got a hip problem, you've got a knee problem, you need to advertise all those types of technologies. If you don't, then, you're really not, you're not attracting all the pieces of the pie. You're not attracting the people who have been unsuccessful with other stuff. That's really where the big value and draw is that people have tried everything else, and you need to communicate that, this is different. It's not what everybody else is doing, because this is the other thing. Any practitioner with a soft wave or shock wave, you'll be competing with their marketing, with their advertising. If their price is cheaper, if their hours are better, they like the doctor's face better, all this stuff, people can get shockwave and softwave anywhere. A number of different places in Las Vegas, they can only get what you've got with the decompression table, robotic laser decompression, they can only get with you. So being unique, this is where, you gotta really push it out and make sure that people know about it. Chris, you said too, when I was there, you were lecturing a guy, a softwave guy, but well, if you don't tell people you got it, you're not going to be using it. That's just marketing 101. So I think this is where we're running into things now with this, because I don't know if we've really capitalized on communicating the uniqueness of it. So I think that's really where we got to go with it. So I'll get you guys, again, some text that you can use for that. The videos that I've done before, I would say maybe emulate them, or you can use mine, the one where I squash my finger in the door. That was a huge attention grabber. People loved that video, and it really got people thinking, and it got patients coming in saying, well, I saw that analogy and it makes perfect sense. That's why I knew that you were the right place to go. So that's what needs to kind of happen. So I think that will, and I think actually the other thing is, I think we've only been marketing the table for a month, because about a month ago was when I gave forwarded Leo the stuff. So I wouldn't be getting too discouraged. We've only been doing this for, I came in January we started this. I'm expecting it's going to take at least a few months to get decent traction, because you have to re-educate, or you have to educate people that things are new. What you have that is new, you also have to be in a position where you are consistent, because people see it once and it's new, and you're like, oh, I don't know if maybe I'm a little worried that it's new. They've been around for a couple of months. I've been seeing this video everywhere. Now I have some confidence in what it is that these people are doing. I know they're not fly by night. I know they're here to stay. So therefore, it's going to take probably 2-3 months to get a really good gauge, at least. I would say 3 months at least, to get a good gauge on how this is actually working. Getting the message right, the message running for about 3 months. So I think, honestly, at this point, I'm kind of picked up that, I don't know if you're thinking that it's just not working for you. I don't think we've given it enough time and effort to actually make it work. As we've only really been marketing it a month. It's only been there for 2-3 months. And, I would like to see from my end, because I did expend a fair bit of resources to get it there, a fair bit of resources to keep there, a fair bit of resources to come out and train. I'd like to give it another few months at least a couple months, do the right things, and not worry about it conflicting with other stuff. Because it's only just more business coming in. Say you want to hit $100,000 months. Well, having more techniques, having more tools, having more things that you can sell to patients, is the right way to do that. So you can let me know your thoughts on this, but I just wanted to send this out just for another couple little pointers and get you an idea of exactly what I'm thinking, because I don't think we've given enough chance yet, and enough focus, and enough proper marketing to really know where it lies right now. So let me know what you're thinking. If there's anything else that you want to tell me, anything else that you're thinking that is, got you thinking the way you're thinking, definitely give me a call and we'll hash it out. But yeah, I really like to see Las Vegas be the premier location. I think it's very possible. You got the right stuff to make it happen. All right, talk to you later, buddy. See you guys. Thanks. Bye. And say hi to the dogs for me.